Earlier this year, Mr. Walker brought the Concord Coalition's Fiscal Wake-Up Tour to the state of Maine. And I will tell you, the numbers are a clarion call to action. The dire consequences are found in innumerable charts, graphs, and spreadsheets. This debate is, however, not just about numbers and cold data. It is about our obligation as policymakers and as citizens to future generations of Americans. The basic problem is that government has promised more than our citizens can afford to pay. Historically, Americans have paid about 18% of GDP in federal taxes. But with the explosion in entitlement spending that is tied to the retirement of the baby boom generation, plus interest on the debt, Americans would have to pay taxes equal to 34% of GDP to keep pace with spending 25 years from now. Even if that were possible, the remedy would do tremendous damage to our economy. It would crush job creation, devastate our already battered small business community, and dash the aspirations and can-do spirit of our citizens. Thus, our decision-making must begin by reconsidering spending that, although popular, simply cannot be justified during this fiscal crisis. This is a moment in history in which we must confront the conflict between what we want and what we can afford. It is time to reassess our national priorities, to make the hard decisions, and to set a new course. We can put this country back on track. We can do what needs to be done to ensure that future generations of Americans enjoy what every American generation has proudly proclaimed as a birthright. And that is the promise of a better quality of life than the generations that preceded it. Thank you, Mr. Chairman. Mr. Walker, I cannot help but observe the irony that we are having this debate about what to do with the unsustainable debt load of this country at a time that we're debating on the Senate floor a huge health care bill that is, in essence, creating a new entitlement program that has enormous consequences for our future budgets, and that the chief actuary for the Center for Medicare and Medicaid Services has estimated will actually drive national health care spending up, not down. And Chairman Greenspan mentioned in his opening remarks just how important healthcare spending is to this whole debate. I know that the Peterson Foundation commissioned the Lewin Group to look at the impact of the Senate bill on long-term costs for the government. Could you comment on what the analysis found and also give us your own views on what we're doing on the Senate floor even as we speak?
Thank you, Senator Collins. It is somewhat ironic. Let me just note that the Lewin Group is owned by United Healthcare, but they're an independent operation. They're not controlled by United Healthcare with regard to what they do. The people that are there are former CBO people, and they do great work. Let me also note that their findings are their findings, not the Peterson Foundation's. But generally, we have found that the Peterson Foundation believes that fiscally responsible health care reform should meet 4 tests. Number 1, it should pay for itself over 10 years. Number 2, it should not add to deficits beyond 10 years. Number 3, it should result in a significant reduction in the tens of trillions of dollars in unfunded obligations we already have. Medicare alone is underfunded $38 trillion and growing. And number 4, it should result in total health care cost as a percentage of GDP that is less after the reform than before the reform. In other words, bend total health care cost curve down, not up. None of the bills meet that. None of them come close on number 3 and number 4. Some of them meet it on number 1 and number 2, but then the question is, will the assumptions that they rely upon with regard to cranking down on provider reimbursements and other things actually be realized, because the track record in the past is not very good in that regard. So I think we need comprehensive health care reform, but frankly the bill that's being talked about now is a coverage bill. And the only reason that people are talking about cost is to pay for coverage. The one thing that could bankrupt America is health care cost. And we're not doing enough to really truly be able to reduce health care cost as well as the rate of increase. That's where we need to keep our eye on the ball. And so far, people aren't doing that.
Thank you. I couldn't agree more with what you've just said.